Hello, my name is Kenzie and I am a student ambassador for the UW-Madison School of Nursing. I'm a second-year student in the traditional Bachelor's of Science nursing program. Thank you for joining us today for our virtual building tour. Signe Skott Cooper Hall, home to the School of Nursing, is located within the Health Sciences campus, which is located on the far west side of the University of Wisconsin-Madison. It includes the School of Nursing, the UW Hospital located across the street, the School of Pharmacy located right next door, and the Health Sciences Learning Center, which houses the School of Medicine and Public Health. The School of Nursing, along with the pharmacy, medicine, and public health programs, capitalize on this opportunity to incorporate interprofessional learning across disciplines into their curriculum. Having a building such as Signe Scott Cooper Hall provides the learning spaces to make interprofessional activities like simulations and seminars a reality. Signe Scott Cooper is an alumna, teacher, and dear friend to the UW-Madison School of Nursing. She earned her certificate in 3 years, but like many of her classmates, left in the middle to serve in World War II and returned after the war to complete her degree. She later became a teacher and had a truly profound impact on her students. She was a pioneer in continuing education for nurses across the state of Wisconsin. She started by literally driving across the state and then evolved to broadcasting on the radio and television to reach nurses everywhere. Her commitment to outreach and teaching is a true embodiment of the Wisconsin idea. The UW-Madison School of Nursing was founded in 1924, making it one of the oldest nursing programs in the country. The original nurses' dormitory, pictured here, served as the main hub for nursing students as they both took classes and lived here. Cooper Hall features Scott Commons, which showcases nursing artifacts that trace the history of nursing, connecting the past with the present and future. Signe Scott Cooper was a noted historian for the nursing profession and provided many of the items in the collection. The centerpiece of this space is an interactive display celebrating our alumni, marking the places where they have made a positive change in the world. It provides a space for alumni reunions, visitor gatherings, and a place to celebrate past and future achievements. Our School of Nursing visitors, alumni, and donors have all provided valuable contributions and community connections and have been instrumental in the making of Cooper Hall. Signe Scott Cooper Hall opened in 2014, made possible through public-private funding partnerships, and was designed to teach the public about the school, our alumni, but also the profession of nursing and its evolution over time. Cooper Hall was a big step for the School of Nursing as it provided a dedicated academic space. Prior to the building's opening, the School of Nursing lived in the hospital, and as a result, nurses lacked a home of their own. The building changed how nursing students are educated. With active learning environments, the building addresses healthcare's new standard of excellence: team-based, patient-centered care that stretches across the entire continuum of care from clinic to hospital to in-home support. Signe Scott Cooper Hall meets the highest standards of green engineering and sustainability and is LEED certified. Walking into the first floor, we noticed that the building was designed to honor the teachings of Florence Nightingale, who believed in the benefits of a natural environment and natural light. As a result, most of the rooms in this building, including classrooms and offices, have windows. With its open and welcoming design, Cooper Hall is also positioned to promote faculty and student interaction and collaboration. Current Commons provides comfortable undergraduate and graduate student common areas. Because teamwork is an essential part of nurses' professional experience, this space offers flexible furniture that can be used for groups working on class projects. This area also offers Wi-Fi connectivity and power access for laptops and several glass whiteboards for jotting down and exploring ideas. During cold Wisconsin winters, the central fireplace adds warmth to the student meeting area and social space. The first floor is also home to the Graduate Student Lounge. A favorite space amongst graduate students, it is great for congregating for group work as well as independent study. Each active learning classroom, or ALC, on the first floor can accommodate 153 students. When merged together into a single classroom, it can provide seating for all undergraduates in the traditional nursing program and for interprofessional courses. It is considered to be one of the largest active learning classrooms of its kind. The ALC provides an environment for students to actively engage with faculty and other students as they explore course content. Roundtable design encourages and facilitates collaboration and makes engaging in discussion easier than a lecture hall. Students learn better and retain what they learn when they are actively participating in the process. Graduate students who serve as TAs also enjoy the active engagement these rooms foster among the students they teach. Imagine small groups of students working together at each table on a care plan for a patient leaving the hospital. Using their laptops, students bring up the patient's electronic health record and all other relevant information. Each team can use dry erase boards small enough to be used on the table, but large enough to be shared with the whole group. Once the team is ready to share their ideas with the rest of the class, they can do so on the team screen as well as on 34 screens in the ALC. Like ALCs, the two-tiered seminar classrooms, Shern Hall and Unity Hall, encourage flexibility and teamwork. Each pair of rows is placed at exactly the same level, and smart table design allows students to turn around and quickly form 15 groups of 4 that can work together on team assignments. This concept allows instructors maximum flexibility in the use of diverse learning techniques. Our graduate students utilize these rooms for lectures and student presentations. The smaller classrooms on the second floor are also used for graduate classes. The small room setup stimulates conversations and interactions between classmates. Our C10 or Center for Technology Enhanced Nursing unit is located on the second floor. More than half of the floor is devoted to fully functional simulated environments, including the 6-room clinic, the Weichel Clinical Skills Labs, Shapiro Hospital Suite, and the Home Health Suite, thereby replicating an entire episode of care. For graduate and undergraduate nursing students alike, the C10 can prepare, complement, or expand additional care opportunities and provides interaction between clinical experiences and skills training. The Weichel Clinical Skills area helps students develop and practice nursing skills and offers a fully functional clinic with 6 examination rooms. The clinic area allows students to practice with standardized patients who are specially trained actors who can simulate behaviors and symptoms of real patients in different scenarios. The Weichel Clinical Skills area continues into the multiple clinical labs that provide an interactive space connecting clinical experience with standardized skills training, such as taking blood pressure and other basic assessment skills on a patient simulator that can be programmed with an iPad. Or for graduate students, advanced practice physical assessment or skills development is taught here as well. Nearby, the eHealth laboratory will let students become familiar with the quickly developing discipline of eHealth and telemedicine. The Shapiro Hospital Suite offers state-of-the-art technology to enable student experiences with high-pressure, high-stakes health emergencies in a safe setting. 5 high-fidelity human patient simulators can stand in for patients at different stages of their lives, from birth to advanced age, and includes a birth simulation. Each simulator can play back a scenario that is advanced by a clinical simulation specialist from the control room behind a one-way mirror. Over 80 such scenarios, developed by teams of nurses, physicians, and pharmacists, realistically play out a progression of symptoms to which students respond. What students decide, say, and do is simultaneously recorded by 3 cameras placed at different angles in each hospital rooms and cameras next to a nurse's station. Immediately after the simulation session is over, students review the video recording of the session in an adjacent debriefing room. Students discuss with their instructor what went well, what did not, and what they learned from the experience. In addition to 4 hospital rooms, 2 control rooms, and 2 debriefing rooms, our simulated hospital suite has a fully functional patient bathroom, a medication room, and a nurse's station where students can access a patient's electronic health record before entering the room. While at the most acute stage of their illness, patients often find themselves at the hospital, but spend most of the time in recovery at home where they will need nursing care and support. The simulated home environment recreates a fully functional 1-bedroom apartment where students can practice providing care in the setting in which patients find themselves most of the time. A raised floor accommodates high-tech sensors, and the area is equipped with cameras and a state-of-the-art video recording and debriefing system. This concludes the virtual tour of Signe Skott Cooper Hall. We are so fortunate to have such a wonderful space to learn in and connect with our fellow Badger nurses and faculty. And after you graduate, there are always events happening within the school for our alumni and friends, so you are always welcome back. Hopefully, from this tour and learning more about our students and the School of Nursing, you have a better sense of Signe Scott Cooper Hall and the exceptional nursing community here at UW Madison. Thank you all for joining us today for our virtual tour of Signe Scott Cooper Hall. Please contact us with any questions you may have.